Ron B. Minson, MD, received his medical degree from UCLA School of Medicine and is board-certified psychiatry and neurology. His general medical background includes serving as a family physician and health center medical director and clinical psychiatrist. Dr. Minson served as chief of psychiatry for Presbyterian Medical Center and the director of behavioral sciences at Mercy Hospital in Denver. In 1990, Dr. Minson learned of the effectiveness of sound therapy after witnessing the successful treatment of his own daughter for severe dyslexia and depression. Dr. Minson successfully studied a number of sound therapy techniques before developing his own, dynamic listening systems, DLS, which he integrated into his psychiatric practice with the advent of digital technologies. ILS was launched in 2007 to provide a more affordable and effective therapy, sound combined with visual, vestibular, and movement, and could be used in homes, schools, and well as clinics. Dr. Minson currently practices psychiatry in Denver, Colorado, serves as a clinical advisor and advanced certification trainer for ILS, and presents domestically and internationally on therapeutic application of sound. Today, Dr. Minson will be sharing with us about dyslexia, autism, and learning disabilities. Dr. Ron Minson.
Thank you for that introduction, and just one clarification, I'm no longer practicing psychiatry. I did hang up the shingle in 2012, but I'm very involved in the integrated listening and training and supervision of clinicians. I have a story to share. 1978, I'm with my daughter who's celebrating her 8-year-old birthday party. She was just finishing up the 3rd grade. She was excited about her birthday party and was rapidly opening presents when one of her classmates and a good friend of hers said, no, Erica, read my card. Well, you could tell that she wasn't too excited about reading the card, but she complied. And she opened the card and began to look at it and try to read. And she stumbled. She was halting. She couldn't decode the words. And this friend, who meant no harm, grabbed the card out of her hand and said, let me read that. And she read it beautifully. And my daughter wanted to sink into the background, as you can imagine. I saw a number of hands go up for those of you who have family members with invisible disabilities or disabilities. And dyslexia is an invisible disability. You cannot see it. So these kids naturally tease other children who can't read. What's wrong with you? Are you dumb? Are you stupid? By this time in the 3rd grade, she had already had 2.5 years of speech and language therapy. She had had special education. We hired tutors. Nothing was helping her be able to read. I didn't know then what I know now, but as I progressed through this story, it's important to realize that these children, with the best of educational interventions and opportunities, many of them cannot learn to read because it is not an educational disorder. Dyslexia is a neurological disorder. It has to do with how sound is processed through the nervous system before it gets to the brain. So typical of many children, Erica followed the progression of going downhill. By the 3rd grade and 4th grade, she diagnosed herself with being dumb and stupid. And this is not uncommon. The dyslexia was not going to result in her dying, but her depression was, and it became very severe by the time she was 18 years old. She had already dropped out of high school, fitting another statistic about the numbers of children, about 1/3 drop out of high school, pardon me, who have learning disabilities. So a good friend of mine knew about our plight with my daughter and her learning disabilities, and she learned about a program out of France. And she said, Ron, I think you need to do this program. It's based on sound and music, and I think it would really help your daughter. Well, it seemed implausible to me as a physician that a music program of whatever sort was going to help her read when well-studied and documented educational tools have shown some degree of help in many cases of dyslexia. So I wasn't too encouraged. But the father part of me said, we've got to do something. By this time, she was suicidally depressed. She was had dropped out of high school, had gotten fired from every job that she had. So we did the program together. This is called the Tomatis method. This program saved her life, and it changed my career. I'm one of those who raised his hand and said, yes, I decided to do something different. So not only did her dyslexia improve, but also her depression lifted. Now mind you, this depression had not responded to antidepressants, psychotherapy, and every other known intervention that we have. It did not respond. I apologize. So here was an intervention using sound that not only improved her dyslexia, but also cured her depression, where nothing else had worked. Non-invasive, no side effects, thank you, no side effects, and it was effective. So, I had to find out more about this technology. I studied with Dr. Tomatis, and I became trained in his method. And at that point, I decided to change my career from a full-time psychotherapy practice in Denver to working with children where I could help them without medication and have a program that was effective. So dyslexia, as I mentioned, is a neurological disorder, and it's not an educational one, although it shows up when a child goes to school. It's already present long before they go to school, but it doesn't show up until they're asked to start being able to read. Some myths about dyslexia. Often people say, oh, dyslexia means that you reverse your numbers. Not so. It is also not the cause of sequencing errors, which are very, very common. It's not an educational disorder. It is a neurological disorder. So when I was with Dr. Tomatis, early on I said, Dr. Tomatis, I don't understand how your program of music and sound was able to help my daughter read when nothing else had been effective. How is it that sound can do this? And he looked at me compassionately and said, well, it's obvious. Have you ever had someone tell you something's obvious when you don't have a clue what they're talking about? So I stood there and stumbled back and forth and said, well, I just didn't open my mouth to betray my ignorance. So what I did is, he said, well, it's obvious we read with our ears. Didn't quite know what that meant. So, as I said, and he went on to explain that the ears give the letters life. They bring it to life. These dead symbols can look like hieroglyphics to a child trying to learn a language, and they have no meaning. But when you bring sound to bear upon the letters and the words, they now are brought to life, and the child knows, oh, I know what that means. One of the strongest predictors of dyslexia in children is the inability to do just that, to take the sound and put it to the letter and to do what teachers call decoding, a very strong predictor of children who are susceptible to dyslexia. So there are three, I want to go back to this one. At the bottom, I guess I have a pointer, don't I? Ooh, how pretty. It's an auditory processing problem. This is the basis of the neurological issue. That's where the problem is, an auditory processing problem that has to do with how the sound is interpreted and how it's processed through the lower part of the nervous system before it gets to the brain. So it's a subcortical disorder of neurological processing that has to do with decoding, sequencing, and speed of processing. So the first part is the decoding portion, and many children have difficulty understanding the differences between certain words that sound very similar, like fat and that. They have difficulty. Even more difficult for many of them is the discrimination of short vowel sounds, or just vowels in general, like tin, and ton. Erica was a total loss at this. I remember one time sitting with her as she was working with a speech-language pathologist, and this happened to other therapists as well, and the therapist was saying, eh, and Erica said, ah. No, Erica, the sound that we're working on right now for this 10 is eh, ah. This went on for a while. The therapist became very frustrated and said, no, Erica, it's eh. And she said, ah, that's what I said. So she's saying what she hears. You see why it looks like a hearing problem? That you can't hear right what's happening? But in fact, the confusion and the frustration of the therapist is only exceeded by that of the patient or the child who's trying to learn how to decode these sounds. It's tragic. And for those of you who are parents who see your child go through these struggles over and over and over again, it's hard for me to convey the degree of frustration and helpless and impotence that I felt as a parent. I couldn't protect my daughter. That's what dads are supposed to do. Protect your child. Another common contribution to difficulty with processing of sounds are chronic ear infections. And many, many children in my practice had chronic ear infections, usually due to food sensitivities. This diagram of the ear helps you to see where the ear infections occur. They occur right in here in the middle ear. Here's your outer ear. Sound comes into the eardrum. You have 3 bones here that transfer the sound to the cochlea, and there are muscles attached to them. But what I want to emphasize is that the eustachian tube, frequently due to food allergy, swells. The fluid that's normally secreted in the middle ear cannot find egress, and it collects in here and forms a petri dish. It's dark and it's warm, and bugs love to grow there. And this is where your ear infections occur. The other thing to point out is this ear is a normal ear. It's the same ear that children with dyslexia have. The problem is not here. It's going to be, I'll show you later, where it occurs in the brainstem. The second issue of auditory processing, besides the decoding one, is that the children have to decode the sounds, hear them in the sequence in which they are presented. If a teacher says, spell desk, and the child might write down dex. Frequently, this has been misinterpreted as a visual processing disorder, and it is not. It's an auditory processing disorder. There are 30 or 40,000 hair cells in each ear, and each one of these clusters is specific for particular frequencies, all the way from 20,000 to 20,000 hertz. They have their own individual discrete pathways. Consequently, there's a particular sound like the S gets held up at one of those synapses that Dr. Potter was talking about, it'll get delayed. So the D and the E and the K get there fine, but the S is delayed, so the child hears dex rather than desk, and they write exactly what they heard. It's not a visual issue, it's an auditory processing issue of difficulty with sequencing. The next issue that is common with auditory processing disorders and very, very commonly seen with dyslexia is the speed of auditory processing. When these children come in, they would often stammer, stutter, try to get a running start again in what they're trying to say. You ask them, well, what'd you do after school? I went home and saw my friend. My friend and I, then we went. They have a difficulty putting together the sequence, the sounds, because the information, the ideas, the things they can see in their right brain has a hard time getting over to the left linguistic, logical, linear language part of the brain. And so they have slow expressive language as well as the slow receptive language. I talked to maybe a child who came into my office, and I said, well, what's the problem you're having with school? He said, my teacher talks too fast. The problem is they cannot keep up with the speed with which normal conversation is taking place, and this is an auditory processing disorder of speed of processing. Some letters and sounds are very, very short. To discriminate between big and dig, the difference is only 40 milliseconds. So if their sound is not being transferred through all those relay stations appropriately and accurately, then they're not going to be able to discriminate those subtle, very, very short differences in the sound. This is a diagram of the auditory pathways, and I've spared you a more detailed diagram of the pathways. So this is a good example. The sound comes into the ear in the cochlea, and 70% will cross over to the opposite side. So if we're looking at the right ear here, 70% will go to the left hemisphere, which is where in about 95% of people that the language is located. And 30% will go to approximately the same side. It goes to these nuclei here, the cochlear nuclei, and then crosses over. And there are many relay stations. And those two important relay stations here at the inferior and superior colliculi. The inferior colliculus is where sound comes in. The superior is where vision comes in. It's a very important relay, and there's communication between these two, because when someone says, "Hey, Erica," and you hear the sound, you turn toward the direction of the sound. So the auditory portion has to go to the visual portion to move the eyes, head, and neck toward the direction of sound. There's a lot of places where sound and visual are actually communicating one with the other. Something exciting I learned a number of years ago is in the superior colliculus, they have neurons. We were taught earlier on that neurons do one thing and one thing only, and hopefully they do it well. In the superior colliculus, there's something called trimodal neurons. It's a single neuron that can actually process vestibular, auditory, and visual information simultaneously. And there's a number of these. There's one in the brain that does the visual, the auditory, and the somatosensory as well. So one neuron has the ability to integrate sounds from different senses in the brain. Not much more to say about that. One thing that was very, very common in my practice was to see children come in, they're awkward, but more importantly, boys were never selected to play baseball. They weren't on the team. They were last to be chosen for anything athletic. And they were clumsy. They were awkward. They couldn't organize their movements. I called that dyslexic in their bodies. Just as they had difficulty organizing their brain for sound and sequencing and speed, they were clumsy and awkward, and they were very, very dyslexic. My daughter often said, "I don't know what to do with my hands." She felt very uncomfortable inside of her skin. So how can you begin to recognize some things that might give you a clue as to whether your child or your client is going to be a good reader or not? When they're really young and they can name objects like bath and bottle and water and baby and teddy bear, this is a good sign that they're getting the language encoded properly. And the next level, as they get slightly older, is when they can put letters and names together. And this is a good predictor that the child will be doing well. But sometimes there's also things you can do as parents to help your child have a better chance of being a good reader and avoiding dyslexia. One of those is to spend time around the dinner table. It pained me to ask parents how they spend their evenings together. And they usually have the TV on, not usually, many of them have the TV on. Or the kids are allowed to use their little Game Boy at that time, or they're using other computer technology and handheld devices, and they're not talking, they're not listening, they're not communicating, they're not dialoguing. This is very, very sad. And it's been shown statistically in the literature that families who spend more time talking and listening and dialoguing with their children have better and earlier language development, which is the foundation for reading ultimately. You have to have the language base in order to be able to do the decoding and the speed of processing and the sequential processing. The quality of the environment, by that I'm talking about studies that have shown that people who live in poverty, single parents, they're not exposed to language, they're not exposed to opportunities because of many, many environmental factors, so they often start school at a tremendous disadvantage. So what can you do about this? One of the things I really want to share today is to help you understand that as teachers, parents, educators, clinicians, therapists, you can all learn how to help a child with dyslexia. No, you can treat dyslexia and help them overcome dyslexia by understanding the neurological foundation of dyslexia and then having the opportunity to use a system or intervention that addresses the dyslexia at the origin, namely the neurological disorder. So integrated listening system is that, and I did study with Dr. Tomatis, and I shared with you that I developed the dynamic listening system, which then got incorporated into the dynamic listening became part of integrated listening systems. One of the things that I was slow to recognize was that I knew sound was helping, and it was working the auditory pathways and improving the processing of sound. I didn't realize how important movement is. And when we added movement to the listening, the rate at which children improve, whether it's attention or sensory processing disorders or dyslexia or other difficulties, they all improved much more rapidly when combining the music, the sound of the auditory portion with the motor portion. And of course, we're also improving the disorganization of the body. So ILS integrated listening system, I don't have time to go into all the details. Please go by the booth, look at it, put the headphones on, see what it looks like, listen to the music. And there's one other piece called the Voice Pro, which is when your child starts to improve their receptive language, then we want to help them improve their expressive language. So there's a system that also uses that. It's a multi-sensory bottom-up approach. Remember the diagram I showed of the pathways in the ear? That's what I mean by bottom-up. It starts externally, goes up the spinal cord, the brainstem, and to the cortex where the sound is finally registered and interpreted. That's a bottom-up approach. The educational approaches are top-down. They're relying upon attention, focus, the ability to hear the sounds, to attend, to have the motor output. That's all top-down. And those programs are less effective for many, many children. On the left, you see a diagram of the motor component being used simultaneously with a young girl who has the headphones on. It's hard to see the bone conductor, but there's a bone conductor sitting at the top of the headphone here, and she's doing some movement activities simultaneously with her listening to specially treated sound. On the right diagram, you have a young girl. You see she has a microphone in front of her headset. And the therapist is standing here also with a microphone. So she's doing the Voice Pro where she may be listening to words and she's repeating them aloud so that she can hear them and discriminate them more effectively. The bone conduction with the air conduction enhances her ability to not only hear but feel those sounds in her body, and this improves her reproduction. She may be working on her auditory memory to increase auditory memory so that she can do better in school, and they may have several words that she has to repeat in sequence. So and here she's simultaneously using a ball to toss back and forth. She's listening to the words, repeating them, maybe even standing on a balance board. All of this is multisensory input to the brain to improve overall brain function. How does ILS work? Some of the ways in which we know that it works is one of the most common things that people would say, parents, about their child, is my child's happier. They have a longer fuse. They pay attention better. When they get upset, they reconstitute themselves much more quickly. They didn't come in to be happier. They came in because they had a learning problem, an attentional problem, a sensory processing disorder, or a depression. But one of the first things that happened is they were happier. This has to do with improved physiological state of regulation, where the sound through various pathways, such as the vagus nerve that has a little branch to the external ear, is stimulated, and that vagus nerve carries parasympathetic input that downregulates the sympathetic nervous system. It causes overarousal and inability to calm, to shift gears easily. So this is one of the ways in which we know that this system works. Of course, we're using neuroplasticity. Thank goodness for the brain's ability to change form and function in response to stimulation. So we're not only increasing the numbers of connections and making new connections, but we're also enhancing and improving those connections and neural pathways that already exist. I just have to keep emphasizing the importance of body organization. Body organization is the foundation of higher learning. It is the foundation of cognitive processing. If you have poor body organization, the brain does not have the resources to do the attention, the focusing, the inhibition of impulses in order to process and to function normally. Interestingly, too, did you know that music and language both share the same neurological pathways? That's pretty incredible, fortunate for our work and for children with dyslexia, because they can listen to classical music that has been specifically altered to help focus the frequencies on their areas of difficulty. And so by using the music, you're using all the frequencies of language and more. You're using prosody, the changes in the intonation of the music, which we use for language. You're using sequencing of sounds through the different music. You have fluctuations of tempo and rhythm. All of the things that involve language are already being enhanced and improved and supported by music. And then you add the language component to it. You can see why this makes sense. Bone conduction of sound is really important. Dr. Tomatis added bone conduction to his system back in 1974. At that time, a number of children would get over-aroused. They would have meltdowns when just using sound through the airway system. And when you added bone, that statistic of 25% or so dropped to less than 5%. They were embodied. They felt grounded. They felt present. And not only that, but the bone's conductor also stimulates the vestibular system. And that goes to every single muscle in the human body, including the 6 extraocular eye muscles that are involved in teaming and tracking. I need to move on, but I love talking about bone conduction. This is just a brief picture of the brain. It would not be an exaggeration to say that reading is basically distributed throughout the whole brain. You have the sound that comes into the auditory cortex. It goes to Wernicke's area, which is where it's interpreted. At the angular gyrus, you have input from the visual cortex, where the meaning and the sound symbol relationships are coordinated. And then you have the supramarginal gyrus up here that organizes the pathways of motor movement. And all of this gets sent to Broca's area, which is the motor speech area here, which takes information from the motor strip and organizes it into the appropriate sequences for speech. Got it? Good. But anyway, it's really, really fascinating. And I don't have time to go into the cerebellum, but it's also a very, very important part of language. I have a love affair with the cerebellum when I found out that it, in fact, goes to the frontal lobes, is involved in speech, language, emotional regulation, not only the motor control and sequencing, but all of these other things. And attention comes from input from the cerebellum, which is enhanced by the movement activities and also by the bone conductor. There was a study that I'd like to present very briefly. This study was done at Kingsway Elementary, a public school. And this is a controlled study with autistic children, but what we're looking at here is their difficulties with auditory processing. And these children were in a school where they already received ABA therapy, and am I in the right place here? Yes, OT and speech and language, and they were matched by age and sex and these kinds of things, and by grades, to a program that only used ILS, Integrated Listening System. There were some objective measures of their abilities, auditory processing, and I'm just going to go through the results. The ILS group improved by 36 percentile points on the scan, which has 4 subsets of measuring auditory processing. And the control group actually lost ground, and they lost 6 percentile points. Now, mind you, the control group is this group that was already getting conventional therapies that were proven to have some benefit. And next. This is the graph that shows the differences, and one of the biggest changes was, in fact, in auditory processing, which you see right here. But balance and coordination and other issues also improved, the green showing those improvements over the control group. So I've mentioned some of the pain of dyslexia and the difficulties and the dread the parents have when seeing their child just continue to go downhill. 35% of them drop out of school. 65% will wound up with drug and alcohol abuse, and many of them wind up in juvenile detention or prisons. But there's a gift to dyslexia. There's the other side. Many people who had dyslexia have, in fact, turned into great entrepreneurs. They go into architecture, art, music, and so forth. So we have a short video that I'd like to show. It's only 1 minute and 45 seconds, which is exactly what I have. So if we could see the video, please. So thank you. By understanding the neurological basis of dyslexia and how they also have many gifts, I hope that you will encourage parents and others, no matter what, love their children. Help understand what is going on, explain to others so we can help protect them from the slings and arrows of outrageous fortune, of abuse and criticism and belittling and shaming and bullying. This happens far too common. I thank you very much for your attention. Thank you.